Hello everyone, today we are going to do one overdenture case, implant supported overdenture case. But before that I will also show you that how do we plan those cases. So we have a face scanner, we have taken the CBCT, we have prepared the guide. So we will do everything step by step and we will show it to you how actually all these tools can help you make your life better and implant results much better. So let's go now. કેમ છો અંકલ? આવી જાઓ, જય શ્રી કૃષ્ણ. બેસો. હવે આ બધું છે ને એના માટે કરીએ છીએ કે તમારું પ્રોસિજર થોડું ઇઝી થાય અને વેલ પ્લાન્ડ થાય. ઓકે, સો એ બધા રેકોર્ડ્સ અમે લઈએ છીએ સો ડેટ જ્યારે તમે ફાઇનલ અમે ઇમ્પ્લાન્ટ અને ચોકટાને જોઈન કરીશું ને ત્યારે અમને બધું ખ્યાલ હોય, ત્યારે કઈ સ્ટેપ લેવું હોય તો અમને ખ્યાલ હોય કે ભાઈ આ વખતે આ સ્ટેપ લેવું જોઈએ. કારણ કે આપણી જોડે હાડકો બહુ ઓછું છે, રાઈટ? અમારે લિમિટેડ હાડકો છે, એમાં જ આપણે રમવાનું છે. ઠીક છે, તમે એકદમ પ્રોસિજરમાં એકદમ રિલેક્સ રહેજો. ક્યાંક તમને લાગે કે યાર મને અનઇઝી લાગે છે, ખાલી હાથ ઉપર કરો, હું પ્રોસિજર બંધ કરી દઈશ. ઓકે, એકદમ રિલેક્સ થઈને બેસ.
આપણે રિલેક્સ જ છે, કોઈ જાતનું ટેન્શન નથી.
As soon as we taste the scan, the software tells us that it is properly done or not. It turns into red. Okay. હવે અંકલ તમારે છે ને સીધું રાખો. એક બાજુ છે ને આમ કરવાનું છે, પછી ધીરે ધીરે આમ કરવાનું છે, પછી ઉપર કરવાનું છે અને પછી નીચે. ઓકે, પણ એકદમ છે ને આમાં સામે ફેસ ટુ ફેસ જોવાનું છે. રાઈટ સાઈડ ધીરે ધીરે, ધીરે ધીરે લેફ્ટ સાઈડ, ધીરે ધીરે ઉપર, ધીરે ધીરે નીચે, ફરીથી રાઈટ સાઈડ, ધીરે 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 લેફ્ટ સાઈડ, ધીરે ધીરે કરવાનું છે. ઓકે, છોડી દો, બસ બસ છોડી દો. Okay, so we did the face scanning from the Shining 3D face scanner. It's Matty Smile. Why we have done it? It's a denture based case, so we want a jaw relation of the patient. So what we are going to do, we are going to take a face scan at a normal relation in which the patient is in maximum relaxation, and then we will give him a wax bite, and then again we will take a jaw relation. So this is how we are going to take a face scan in the second time. So now since we have already have the denture in this scenario, so our next scan would be with the denture. Okay, today we are going to use Alpha Bio implant system. This is the guided kit of Alpha Bio system. I will just explain you a brief about it. So this is the tissue punch. This is a small and large. When you are using a larger diameter, then you will use this. More than 5 mm, less than 4.5 mm, you will use this. These are the crystal drilling tools. We will use this. So most of the time we will find a patient with a triangle bone. We need a flat base. So we will use these drills which will create the flat base. These are lens. This is a lens drill for drilling for these stabilizing screws. So we will use these also, and these are the drills. You will see that there are more number of drills than the required journal kits. Why? Because each diameter has a length specific drill. So what we will do is we are supposed to place an implant on 3.313. Okay, there is limited ridge. So we will use 3.313. So ideally we are supposed to use till here, but since first it's an active system, so I will use one diameter less over here. And secondly, how do I reach over here? First I increase my length, first I achieve my length, then I achieve my diameter. So I will start from 2.8, 2.10, 2.11.5, 2.13, then 2.413, then 2.813, and then I am supposed to place implant. These are the drivers which will get and engage into the implant, and with hand ratchet we will do the tightening of the implants. So let's go now. Guide which we have prepared, it's a denture based guide. So we are just checking how it is seating well. Okay, so it's perfectly sitting. It's a transparent guide, so I get to know we have kept it in betadine. So that's the guide which we have. It's a denture based guide. That also procedure we will show it to you, how did we convert the denture into our guide. Close. હવે આ થોડું લાગશે. So now what we are going to do is we will first stabilize our guide. How do we stabilize our guide? बंद करो, एक मिनट, धीरे धीरे बंद करो. So you can first see that whether your guide is properly, this, since I told you it's a denture based guide, so we already have how his denture was seating. So it was exactly seating like this. So what it does, it gives you an idea that your guide is properly seated or not. So now I will ask him to keep it like this, and then I will drill for my stabilizing screws. દુખાવ નથી ને? Keep it like this, keep it like this. बंद 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 बंद, एक बार ऊपर कर दो, बंद कर दो. वेरी गुड. आम જ રાખજો. So this bone suggests that our guide was not into, our drill was not into the soft tissue, it was within the bone. We have stabilized the guide. Now we will start with tissue punch. We are doing this to remove the tissue punch. Flattening drill which I had shown to you. Make sure it reaches to the crest. You can see the bone spicules. So now think on the bone level. Flattening has been done. Now I will start with the first drill, which is 2/8. Go pumping motion. You can see the bone over here. Okay.
Blue needle लगा दिया. कर दे.
So you can see the bone which is present. So we are going within the bone. I am going in the second part. Between the drills you are supposed to use the saline syringe and keep using it within your osteotomy site. What will help is the bone debris or the bone fragments won't accumulate at the bottom, because if they accumulate, then what, your osteotomy won't go till the depth. This is 2 by 11.5. This is 2 by 13. Now I will achieve the diameter. So now the next drill won't be 2.48, it will be 2.413. See the bone. Every time I will keep on checking my drills that I am getting the bone or not. And also understand this drill has a slit over here. Now what this slit does is it allow the saline to go inside, which generally all other drills doesn't have it. It's an slit which will let your saline slip in inside. I am doing my last drill, which is 2.813. Uncle, comfortable? Bas last drill છે પછી implant. Now we are going for the last drill. First I will assign where my drill is supposed to go and then I will let it go. See the bone again. So I am done with my drilling part. I will just check once with my probe, just to have a double check that I am completely within the bone. So I will see the buccal, lingual, similarly buccal. I will go and place the implants. What we want is this part of the blue ring should go and flush with the guide. Will reach the torque, but I will have one more and we are done. We got the first one done. Now we will do the second one. So we are opening the second implant. Now I will just show it to you how you need to attach your implant over here. Now there is a small blue adapter which is there, which is go and engages over there. Then we need to tighten it with the screws. There are long screws which are available. नहीं ये नहीं होगा, पतला वाला. So these are the small screws which we will just tighten it. There is a separate driver for it. Okay. Once done, then there will be an adapter. Yes. Okay, now with an hand ratchet we will just tighten it. This is how it is completely the assembly. Is we are supposed to make sure that this border goes and flush with the guide. So this is in post-op X-ray. You can see the parallelism. These side pins are the stabilizing pins which we have kept. Now you can see the bone level and the implant level. This is as per what we planned. And now you can see how we are supposed to remove this thing. This is a driver and we are just going to unscrew it. Similarly over here, we will just unscrew it. So now you can see we have placed the two cover screws, and this is how the implants are placed, flapless, completely done, palatally placed, because that's how the bone morphology is, which I will show it to you on a CBCT. So now I will go through the planning part of it. So you can see over here what we have done is we taken the two scans, one the patient wearing a denture and the other of only denture. What we are doing is we are superimposing the two data. How do we superimpose? There are common points between the patient wearing a denture and the denture. That's our radiopaque markers which we have put. Once we are done, then we are getting the entire virtual patient in front of us. So we have the denture and we have the bone. Now we will do the implant planning. So you can see there are two implant plans because there is a sinus which is pneumatized. So I can't place implants in the posterior aspect. So we place two anterior implants. That's 3.313 which I showed to you, and you can see it is much more palatally approached because there is a deep buccal concavity which is present. That's why we wanted to go little more palatal. So accordingly we have planned the implants, and this is the first implant and this is the second implant. So you can see this is how which we have done.